Hey, this is Neurological Medications with Mrs. McGee. We're going to talk about the nervous system. You can look at chapter 47 to get a nervous system physiology and anatomy review. Remember that the CNS includes the brain and spinal cord, whereas the PNS is all the nerves throughout the autonomic nervous system. And obviously the muscles in the body go with that. Drug overview is we're going to be talking about skeletal muscle relaxants, neuromuscular blocking drugs, Antiparkinsonian drugs, and anticonvulsant drugs. Muscle relaxants will relieve musculoskeletal pain or spasms, or relieve severe musculoskeletal spasticity. Spasticity is increased muscle tone, like the muscles feel really tight and the reflexes are really exaggerated. Centrally acting relaxants are also known as spasmolytics. They treat spasticity related to multiple sclerosis, or cerebral palsy. They can also treat acute muscle spasms that could be caused by anxiety, inflammation, trauma, or pain. Centrally acting means that they prevent your brain from sending out signals, and this causes a decrease in heart rate and blood pressure because the signals aren't getting there either. The example drugs are Robaxin and Flexeril. They start to work in 30 minutes to 1 hour. You can also use rest and physical therapy to help with this. They do not want you to be on any other CNS depressants at this point because it can cause physical and psychological dependence. Always take with meals or milk, and it can cause drug-induced drowsiness. Please watch the rigidity versus spasticity video on the playlist. Dantrolene is a directly acting on skeletal muscles drug. It is not to be given to weak patients, and it treats spasticity related to patients that have cerebral palsy, multiple sclerosis, a spinal cord injury, or even stroke. It can prevent malignant hypothermia, which is a complication of anesthesia. Skeletal muscle rigidity is a sign and symptom, and a high fever. This one's not to be taken with verapamil, can cause liver toxicity and bleeding and seizures. Baclofen. It can take hours to weeks to work. It is the drug of choice for spasticity. Paraplegic or quadriplegics with spinal cord injury or caused by multiple sclerosis or trauma. It can be taken intrathecally, which means that it can be directly injected into the membrane around the spinal cord. It causes transient drowsiness. With lithium taken together, it can cause hyperkinesia, which means that there are abnormal, increased, uncontrolled activities or muscular movements. Seizures is common with overdose or withdrawal of this drug, and we need to understand what seizure precautions are, and we'll talk. And this slide shows us that seizure precautions include privacy, 2 to 3 side rails up and padded. That's the specific thing for the side rails. Oxygen and suction available when in need. Already have oxygen tubing at the bedside. There's a pillow under the head to prevent any aspiration. The bed is always in the lowest position if they should fall out. And then the patient is in that left side lying position, which is especially important immediately post seizure. Neuromuscular blockade agents are given for people who have surgery, people who are on the ventilator and fighting against it to breathe, and people who are having drug-induced or electrically induced seizures. It can decrease the intensity of the spasms. Some examples of these are atracrium and succinylcholine. They are given IV. These patients are conscious, awake, and able to feel pain. They are just and only paralyzed. They're unable to communicate. There is a test that we do to see how paralyzed a person is, and it's called a train of 4, and it's to do with the muscle spasms caused by electrical stimulation by TENS unit. One thing that you have to know about these agents is that the patient is unable to close their eyelids, so you may have to actually tape them down to prevent a retinal damage from dry eye, pretty much. Now let's move on to talk about Parkinson's disease. Parkinson's disease patients are talked about in Med-Surg Chapter 48, but in this picture we're looking at all the signs and symptoms of Parkinson's disease. It's a very slow, progressive disease that is caused by the degeneration of the CNS. And if you look at the sign and symptom that is called peel rolling tremors, it's actually a rolling of the fingers back and forth like they were going to roll a cigarette or something like that. And I think that you guys can figure out the rest of them. All of them we have defined so far. Antiparkinsonian drugs. Parkinson's disease has 4 major features: muscle rigidity, tremors while at rest, akinesia, and bad posture or balance problems. The goal of therapy in Parkinson's disease is symptom relief. So we're going to be treating the 4 symptoms that we just stated. We want to maintain our patient's independence and maintain mobility. The types of antiparkinsonian drugs that we're going to talk about are anticholinergic, dopaminergic, and COMT inhibitors. Generalized teaching for antiparkinsonian agents include: don't stop any of these medications suddenly. Don't crush or break any pills or tablets. Do no hazardous tasks. These people shouldn't be running a forklift. They shouldn't take any over-the-counter medications without checking with their physician first. And if they have dry mouth, the best way to combat that is ice chips or sugarless candy or gum. Anticholinergics. The one that we're going to talk about is cogentin. It controls salivary, and that is excessive salivation. Think about diarrhea, but with saliva. Rigidity and akinesia. Adverse reactions include eye issues, CNS issues, urinary retention, and dry mouth. Dopaminergic drugs include levodopa and carbidopa-levodopa combination drug. Levodopa is the most effective for Parkinson's disease, but you have to gradually taper this to stop or risk that you have a Parkinsonian crisis. Carbidopa prevents levodopa from being converted to dopamine as soon as it hits the bloodstream, which allows more levodopa to get to the brain, so smaller doses are needed to actually reach those therapeutic goals. So the combination drug is the best for the patients. And a Parkinsonian crisis includes acute akinesia, which is a life-threatening complication that is related to the loss of the ability to move all muscles or being frozen in place. Signs and side effects of levodopa include nausea and vomiting, neuroleptic malignant syndrome, arrhythmias, irritability, confusion, eyelid twitching, which is actually a sign and symptom of an overdose. Remember to take at bedtime to reduce all of these side effects, and test for diabetes and acromegaly while taking this drug. Know that neuroleptic malignant syndrome can be caused by neuroleptics and antipsychotics. The signs and symptoms are fever, confusion, rigid muscles, varying blood pressure, increased heart rate, and sweating. Also, remember acromegaly is excess of growth hormone. COMT inhibitors include tocopamine and cantopolamine. These are added to the levodopa-carbidopa combination patient if they have wearing off of effects before the next dose of the combination medication. They have no anti-Parkinsonian effect alone. They have to be given with something else in order to actually do any work at all. These medications can cause orange to brown urine discoloration, orthostatic hypotension, hallucinations, liver failure. So informed consent is actually required to give these medications. You have to have a liver function test baseline, and then you have to take liver function studies every 2 weeks for an entire year. These medications are really risky. Anticonvulsant medications. They are used for the long-term management of epilepsy or the short-term treatment of seizures that are related to trauma or maybe brain surgery. They can also be used for emergency treatment of status epilepticus, which is when a patient has a seizure after seizure after seizure with no recovery time for the brain in between. It is an emergency situation. Anticonvulsant drugs continued. Treatment begins with a single drug, one drug at a time. They increase this drug until the seizures are controlled or no adverse effects are causing them too much trouble. Then a second med should be tried alone before adjunct therapy. So that means we're going to try a second drug all by itself, taking away the first drug before they ever try 2 drugs together, because these drugs are really risky to be combined. If you're confused about what epilepsy is, it is a medical condition that produces seizures affecting a variety of mental and physical functions. It's also called a seizure disorder. It's when a person has 2 or more seizures, they are considered to have epilepsy. A seizure happens when a brief, strong surge of electrical activity affects part or all of the brain. 1 in 10 adults will have a seizure sometime during their life. Seizures can last from a few seconds to a few minutes. They can have many symptoms, from convulsions and loss of consciousness to some that are not always recognized as seizures, such as blank staring, lip smacking, or jerking movements of the arms or legs. This is actually what's going on with your neurons during the epileptic situation. There are several different types of seizures, and we're going to cover this in chapter 48 of MedSurg, and you can look there for more information. The 2 main types that are listed here are tonic-clonic, which are grand mal seizures, and then absence, which is a petit mal seizure. On a tonic-clonic seizure, you have sudden rigidity, muscle jerking. This is the classic seizure that everybody thinks of when you're talking about seizures. The absent seizure is completely different. This is a person who's just blankly staring, maybe beginning and ending abruptly. You don't even know that it happens. A lot of times this is in younger people and even children. This is just another visual to show you how many different types of epilepsy there are. Focal epilepsy means that there's a focused point where the muscle spasms and symptoms are happening, and then generalized mean that it's happening throughout the entire body, throughout every muscle that could possibly be involved. There's a bunch, huge list. Now, the first aid for seizures. First off, we want to be able to recognize common seizure symptoms. Blank staring, confusion, sometimes urination. But you can read those. Then we want to follow the first aid steps. If they're having a seizure, you want to keep them safe. That's the main goal. You want to lay them, if they're finished with the seizure, in that left sideline recovery position. You can read all these. This is a really cute slide to help you know exactly what you're supposed to do if you come in contact with someone who's having a seizure. Anticonvulsant drug therapy teaching. If they have a loss of appetite, that's a bad sign. You may need to change the medication because of it. You want to avoid hazardous activities. Here again, we're affecting the CNS system. These people have decreased alertness, so they're not going to be driving a forklift or a car. They need to be wearing a medical identification band that states that they are epileptic or have seizures. You can adjust the dose PRN to increase the dose at a time when you're having more seizures and more stress, and vice versa. And you want to always record any seizure activities so you can show the effectiveness or the lack thereof to your doctor when you go back. DILANTIN is the first medication that we're going to talk about, and most of these have therapeutic levels, so you're going to have to memorize them. It's also known as phenytonin. The therapeutic level is 10 to 20. You must stop tube feedings 2 hours before and 2 hours after so that you don't encourage aspiration. If it's IV, you can only mix with normal saline or precipitation may occur. That means that the chemicals mix inside the tubing, causing a chemical reaction, and it can even cause a chemical reaction inside your patient. You need to use an IV tubing that has a filter, and there is a huge chance of the rare complication of purple glove syndrome, which is when the hands and feet become swollen, discolored, and painful. Here's another slide that is showing you some signs and symptoms. It's showing you side effects of the medication. It's giving you a mnemonic to remember these side effects. The mnemonic is gums, the G being gingivital hyperplasia, U is use alternate birth control methods, M is provide good mouth care, S is soft toothbrush. It's pointing to the 10 o'clock to remind you that that's where the therapeutic range starts, 10. Phenobarbital is the next medication that we're going to talk about. It is given for partial, tonic, clonic, or febrile seizures. It is a delayed action medication. It can cause CNS depression. It can cause nystagmus, which you should remember is a repetitive and uncontrolled eye movement. Laryngospasm, which is a spasm of the vocal cords, and respiratory depression. Next medication is Carbamazepine, otherwise known as Tegretol. It's a drug of choice for adults and children that have general tonic-clonic seizures or partial seizures. It can also treat trigeminal neuralgia, which is chronic pain disorder of the trigeminal nerve, and that's on one side of your face, and it causes severe pain on that side of your face. It can cause some serious hematologic toxicity, so that means that your blood system and the ability to create new blood is a problem. It can also cause hives or lead to Stevens-Johnson syndrome, which is a severe skin reaction that may lead to an epidermal necrosis. This slide about Tegretol explains to you that it is a prophylactic seizure medication, so it's preventative for seizures. Notice that the side effects include drowsiness, nausea, vomiting, blurred vision, and headache. Important not to take this with grapefruit juice. It's a contraindication, and taper to remove the drug. You can't stop this cold turkey. This is an example of the anticonvulsant hypersensitivity syndrome, which is like a diffuse rash all over the body. Benzodiazepines treat seizures. We're talking about clonazepam, diazepam, and lorazepam. Clonazepam is a long-term treatment, whereas diazepam is an acute treatment during the seizure. And then lorazepam can actually treat status epilepticus. Sorry. Anticonvulsants, they are also anti-anxiety agents. They are also sedative hypnotics and muscle relaxers. They do all kinds of things. Diazepam. A new route for you guys is rectal gel. It's used for short-term effects, so it needs to be given with a long-acting anticonvulsant to keep them from having another seizure. It does have a great potential for addiction. It is a CNS depressant as well as a respiratory depressant, and it also decreases the heart rate. It should be given if you give PO with food. If it's in a solution, like an IV solution, it should be diluted so that it doesn't hurt the vein that you put it in. And this is a fun little slide about Klonopin. Remember, this can treat seizures or panic attacks. It's only given PO. Some of the side effects include drowsiness, ataxia, behavior problems, aggression, irritability, and agitation. Those are some major behavior problems. Do not stop this abruptly because withdrawal can cause even more problems, as you can all read. So make sure that this medication is tapered off and not suddenly stopped. Valporic acid is used for the long-term treatment of absence, myoclonic, or tonic-clonic, or partial seizures. It can even be given for neonatal seizures. There is a potential fatal liver toxicity. And here we go with another therapeutic level of 50 to 100 this time. Here we go with Gabapentin. The other name for it is Neuron. It's to be given for treatment of epilepsy for people 3 years and older. It can also be given for diabetic neuropathy pain, neuralgia pain, or tremors from multiple sclerosis. It can be given for bipolar disorder, or migraines, or even Parkinson's disease. So it's got many, many uses. It's best that you take Neurontin or Gabapentin at bedtime to decrease the side effects, and then gradually withdraw, because if you withdraw this one quickly and don't taper, then you can actually cause seizures to happen. More about Neurontin. See, some side effects there are confusion, depression, fatigue. You can actually overdose on Neurontin and get slurred speech, lethargic, or even have diarrhea. There is a huge potential for abuse of this medication, and they have changed the schedule for it, and it is now considered a narcotic and is locked, as well as all your other pain medication. Lamictal is used as an adjunctive therapy. There's a black box warning for a rash. Think about our rash that we talked about earlier. This rash may be life-threatening. Stevens-Johnson syndrome that we talked about with the necrotic skin. Trileptal is the next medication we're going to talk about. You need to remember to give reduced dosages for renal impairment. If it's an oral suspension, then you need to shake well. It can cause somnolence, which is a state of strong desire for sleep or sleeping for unusually long periods of time. Trileptal is an anti-seizure drug that can be given for anybody over 2 years old. Topamax. It causes psychomotor slowing, difficulty finding words, impaired concentration, and memory impairment. It can also cause liver toxicity or pancreatitis. Signs and symptoms to report related to pancreatitis are abdominal pain, nausea and vomiting, and anorexia. It can cause neural tube defects, so do not use during pregnancy. And make sure that you're using contraception if you're taking this medication, and possibly 2 different methods of contraception. Topamax can be given for seizures or migraine headaches.